Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, I want to put a little bit more of a face, a human face, on this deal. When you stop and think about it, and I'm just going to tell you the truth about it, the numbers are real. There are 425,000 individuals that have been affected by United Healthcare leaving the state. That number was roughly the same when the previous healthcare provider left the state. And on the story goes. So those are individuals. So let's say we have 2 family members per individual who has been affected by this, who've been dropped off the rolls, who have no place to go, who have no more advocate, who has no care provider. They're simply cast adrift on a sea of anxiety and despair and hopelessness. Multiply it by 3, and suddenly we have a third of the state living in despair, not knowing when or where or how their family member is going to get the care that they deserve by virtue of their humanity. A third of the state. That's a fairly big number. I would think that that would be a little bit of an eye-opener for those of us sitting in here who have been elected by those people, and they expect some modicum of diligence and watch care from us, I would imagine, wouldn't you think? Today, my friend Tom Wadley, who was dropped off United Healthcare's rolls when they left, a paraplegic who broke his neck in a horrific accident, is at Lutheran tonight in intensive care and is not expected to live. Of the 100 or so emails I've gotten in the last 10 days from people just in my little district, 1/100th of the state, a gentleman named Steve with his daughter Carly, who lives with Down syndrome, came to visit me yesterday. Steve is about 6'5" and has a big old mustache and looks like a lumberjack. He's a big, strong man. Representative Ourth, thank you for meeting with Carly and I today. I will attempt to tell you our story in an abbreviated form under the caveat that it's quite a bit more complicated than I can share with you here. He brought his daughter Carly. When the switch was made to managed care way back when, Carly, who has Down syndrome and has an IQ of 50, was living in a host home managed by Mosaic, receiving funding for 24 hours of services per week. Her MCO, AmeriHealth Caritas, refused to pay for those living arrangements. They just stopped paying, and then they just left. We tried to appeal, but they said until DHS provided a denial, there was nothing they could do. And DHS said that until the MCO wrote a formal denial, no appeal could be made, the classic catch-22. No Iowan should be treated this way, for God's sakes. This is unconscionable, and we're letting it go right under our noses like we don't see it or we don't know what's going on. And that's unconscionable. Shame on us for this. In each case where Carly's services were cut, and it goes on and on and on, and now she's left with less than 9 hours of care per week with an IQ of 50. They tried to integrate her into the community, and because of our failure, she had to go back home and will not be integrated into her community. Now, I'll tell you what. Government is supposed to do what people cannot do for themselves. That's the old saying. I remember my dad saying, yeah, that's right. When was the last time you got a couple of buddies together and built a bridge over the Mississippi River that would handle 5,000 semi-tractor trailers a day with no problem? Well, we just don't do that. We're incapable of it as individuals, so we rely upon our government and our pooled and collective resources to do those things for us. This, above all else, is most important. The reason I ran for this office is because I wanted to be able to identify the things that matter most to the people in my district and that matter most to the people in this state, and then join with fellow empathetic and compassionate people who have been sent here also by their constituents and set about the work of making this place better for the people who live here, especially better for the people who need us most and who are most vulnerable in this state. It boils down to a simple matter of choice, my friends. It's not that hard to do. Let me tell you something. This is kind of like going into the garage and the head mechanic saying, hey, the engine's blown in your truck. But that's okay. Keep driving it. It'll work. This is crazy. Well, I'll tell you something. The older I get, the more smart my parents become to me. They used to be the dumbest people on planet Earth when I was a teenager. Now they are among the brightest people I've ever known. It's okay to have made a mistake. It's okay to have tried the experiment of privatizing Medicaid. It's okay to have done that. Other states have done it, and just like our state, it failed. And ours has failed. There is no dispute about that. There is no question about that. There should be no trying to smooth it or glaze it over or turn around and hide. It hasn't worked. And it's okay to admit that and move forward and abandon this mess and try something new. And it's incumbent upon us to do that. Now, we talk about the rule of law in here. For my Christian friends, I'm going to read you a little bit of law. I'll read you some law right now. I'm reading from the book of Matthew, chapter 25. And then the king will say to those on his right, come, you who are blessed by my Father, and take your inheritance. For when I was sick, you came to visit me. He didn't say, well, actually, he said, when I was sick, you took care of me. He didn't say, when I was sick, you prayed for me. When I was sick, you privatized Medicaid and it didn't work. When I was sick, you did this or that or the other thing. What he said was, when I was sick, you came to my aid. You came to my side. You sized it up and figured out how to help me out, to give me what I needed to be whole again and to heal and to regain my dignity and the value that God intended me to have as a creation of his. And of course, we know the rest of the story. The righteous said, well, when were you ever sick and I came to visit you? And that's when he said, well, inasmuch as you have done those things for your brothers and your sisters, you have done so also unto me. And I'll tell you what, people, if you're going to go to your prayer breakfast and we're going to pray every morning, and we're going to call ourselves Christians or any of the other things that we call ourselves in the name of Buddha or Allah or God or whoever it is you worship, you better be paying attention to the disconnect between all that rhetoric and what you actually do. When I was sick, you came to my side and you did something to help me. We have the resources in this state to do just that. And you know what? I would think that our collective will would bend toward those who need us most. We in this chamber have more power, both as individuals and as a collective, to do the right thing for the people who need us most, and you know it. So let's get the politics out of the way. Let's get the partisanship gone out of this thing, because I'll tell you what, the people that are at their homes right now living in abject despair care not about Democrat issues or Republican issues. The only issue they have is that they need us. Mr. Speaker, thank you very much for your time, sir. Ladies and gentlemen of the House, thank you very much for hearing me out. It is time to knock it off and get about the business of acting on the behalf of the people who sent us here to do just that. They're hurting. They need us. And the longer we wait to answer the call to go to their side and help them out, the more shame we bring upon this body. Thank you very much, Mr. Speaker.
To organize